The brave, the shero, Meedie Bardonille is in the well, not in the building,
well,
but
she's not in the building,
line.
but she's technically in the building, right?
Give
Not
it up.
yeah.
Thank you so much for joining us on Spotlight Over the City. How are you?
Terry and Stan, I'm really well this evening. Thank you so very much for having me on your show and allowing me to have this platform. So thank you. I'm hanging in there. A little tired, but I'm hanging in there.
Yeah, you have a right to be tired, for real. So salute to you, first of all, for all the great work that you're putting in. Very, very important in this whole movement. So I'm not going to get into it too much, but I'm really grateful to have you come on and talk about this journey, because a lot of people are unaware of some of the things that you guys are going through.
Yeah.
Absolutely.
Meedie, you are the lead nurse, right? But I want you to tell the viewers and audience a little bit about yourself, and feel free to share some of your background and history of how you became a nurse. And also, you can dive right into what's been going on here. What have you been experiencing? What have you been seeing with your own eyes, and some of the things that you have had to deal with throughout this coronavirus pandemic that's been kind of like in our area for about three and a half weeks now, right?
Yeah.
I'm going to give you the floor and let you tell our viewers and listeners who you are and what's going on out there in the field, in the front line.
So first and foremost, I think it's important to start this off with knowing that I am a person of faith, and that is absolutely how I am personally getting through this pandemic, as all of us are. I am a Howard University graduate in the College of Nursing, and I hail from the great state of Pennsylvania. I'm married to an awesome husband, and I have a teenage son, and I work at a facility here in the district, and I also serve as chair of the DC Board of Nursing. So I'm just happy to be on your show, not as a representative of either of those organizations, but just simply as a nurse on the front line, a nursing leader who really wants us to use your platform that you so graciously shared with me, just to let people really know what's happening and to really understand that this COVID-19 virus pandemic is real, and it's not something that we should take lightly, but something that we need to also really have a good understanding of what's happening and how we can protect ourselves.
Wow.
Right. So what are some of the things that you're seeing firsthand? A lot of things we don't get to see on the news, the regular media. What are some of the things and the reports that you're seeing coming in firsthand as being on the front line?
So, Stan, one of the first things thank you again for that question. One of the first things I really want to share is that this is real, and that people need to understand that the COVID-19 virus is something that is a novel virus, meaning that it is a new strand of the coronavirus. And so because of that, our scientists, we are all familiar with the household name of Dr. Fauci, and others are working very diligently to really understand the virus, how it's contracted, and how we can easily test for it, obviously working on vaccinations and other things of that nature. And so it's new. It is something that we are working on to really get a good understanding of now that it has impacted over 1.5 million people in the world. And so what I see firsthand are several things. One, it's how it's impacting me, myself as a healthcare professional, and my team and others that are in the healthcare realm as well. Additionally, it's important to understand how it's impacting our patients, the patients that have tested positive. And also, we must not forget that people are still having heart attacks. People are still having the need for dialysis. People still need cancer treatments. People still need to see physicians for other medical issues that have now been altered quickly because of the COVID virus. And so it's important that we understand that aspect of it as well. And then I think there's a third part of it, as you all just said, I couldn't be there personally with you because of social distancing. And so in a time more than ever when we need each other, we are actually asked to stay apart from each other. And so firsthand, there's a lot of different, stories, both personal. I now know of 3 personal individuals that have passed away because of COVID-19. And it has been very challenging, particularly as it relates to getting closer to your proximity. And so I really think it's important. And I would just like to share with you both and your viewers to, get the facts, get the information, so as I've been saying, so you can stay well and be well.
Wow.
Well, I thank you for that. Well, first of all, before I go any further, I want to say salute to you for having the right spirit
Yes.
Because I'm trying to get people to understand that this is definitely something that you need to tune your spirit up to and get in tune with God and know who the Most High is, because it definitely is going to play a part in this walk here. So thank you for having the faith to walk this out and the courage to do what you're doing, because I know it's something that you actually are putting yourself in harm's way every single day just to
Yes.
save a life.
Yeah. Meedie,
Absolutely.
what would you say to a lot of the people are saying that, most people are recovering? Is that what you're seeing? I know you did see, you have experience and you know some people who have passed away. Two questions, a two-part question. Are you seeing that most of the people have other underlying health issues as what we're hearing on the media? Or are these, generally healthy people who were working about a month ago and now they're, gone from coronavirus?
So I think it's multifaceted, and quite honestly, Terry, I don't know if there's one specific answer that I can give you, but what I will do is share some very specific facts and details that I received just today. I'm a person who, although I am on the front lines, I absolutely, admittedly, do not watch the news all day long, because I think to your husband's point, I have to maintain that good mental space to continue to do what I do every day. And so what I do, and I would recommend to yourself and your viewers, is go directly to the CDC website. If you're here in the District of Columbia, go to coronavirus.dc.gov to get very specific, detailed information. You can also go to the World Health Organization to get that specific, detailed information. And the question that you specifically asked about recovery rates, those rates are there and they're listed.
Okay.
Here in the district just today, 1,523 positive cases. And of those, we've had, unfortunately, 32 deaths here in the district. 8,724 individuals have been tested with a 17% positive rate. So when you do the math, obviously there's a lot of people who are tested and 17% of them are testing positive. So that right there tells you that, fortunately, I would hope that the majority of us would be able to follow the stay-at-home orders and follow the social distancing requirements that would allow us to be in that number where we're negative. This is a part where we want to be negative and not positive. And so it's important, again, that's where I'm getting that information from. I would also like to add, no longer are the individuals that are getting contracted just 70 and 80 years old. Here in the district, again, the average age of our positive patients are 31 to 40. So of that number that I initially shared, 347 of them are in that middle age range. And so I think that's something that we all should be mindful of. And before I end on that note, in the world, when you go to the World Health Organization website, there's basically 1.5 million people. Exact number is 1,579,690 positive cases in the world. We have already experienced 94,000 deaths in the world.
Wow.
And there is a 20% recovery rate thus far. And so hopefully, again, if people want more specific details on that, please go to World Health Organization, cdc.gov, and or your local jurisdictional public health websites as well. It's all listed there for you.
Wonderful. Perfect. Wow. Listen, I don't want to keep you too much longer. We did get one other question in from one of the viewers who were looking and was excited to have you on. And that is, ask her, is it really, really important? Like people are saying, do you have to really cover your face, wear these masks? What is your opinion about these masks being worn? Is that going to prevent a person really from catching the virus?
So Terry and San, please indulge me for just a few moments. What I actually have here, just a few little props. This is a nice little homemade mask, if you can see, with some simple little ear loops that someone has made. I personally haven't used it yet, although I'm grateful for it because I'm in the hospital setting. And in the hospital setting, this is not something that I would use all day because I'm obviously with other sick and ill patients. I would need to dispose of this and or to be able to wash this. However, for those of you that are not in a medical facility, if you have these, this is a new CDC requirement that just came out this past week. And I absolutely do agree and would say to cover your mouth and your face with this type of a mask. You want to ensure that the virus comes into is entered into your body through your oral or nasal passages and or, which is horrible for a person like me because I'm a contact wearer. You don't want to touch your eye conjunctiva, which is the lining of your eyes. You don't want to rub your eyes. That's how you will introduce the virus to yourself. What I wear, and I have one that I had on today that I bought for your show, is this is a simple surgical mask. And this is what we are now wearing all the time we're in the hospital to protect ourselves. When we go into the room, and I'm sure you all have heard of the infamous PPE, personal protective equipment, and the N95s. This is an example of one of the N95s, and I will share with you, Terry, it is not comfortable. It's hard to breathe. It's hard to talk if you're wearing this all day long. And these are the very important respirators that we need for those of us that are in the healthcare realm, taking care of the actual positive patients. So to answer your viewer's question, yes, I do believe that you should make sure that you wear a mask. We are finding out now that the way the virus is contracted, we initially thought it was droplet. Versus airborne, and we're trying to figure out what that means because they're seeing some differentiation of how that's happening. So just want to let you all know that there is a difference of airborne and droplet. And if anyone ever has any questions, feel free to look that up. But quickly, droplets are basically, if you remember, we all done it where we sneezed in our hands and you felt a little moisture, right? Mm-hmm. Those are considered your respiratory droplets because you sneezed, and those things, which is where they came from, rather, of having the 6-foot distancing. So that way, that person who's 6 feet away from you will not contract any of that. Now we're being told that it is also possibly you can contract it from just speaking. So they want to ensure that the virus is not aerosolized or not something that just comes in the air, which is where these N95 masks come into play for any disease that is airborne. Long answer, but a very important answer to make a very important question for everyone to understand what the differences are and why we need to practice social distancing.
Okay, I had a separate question.
Okay.
I have a ton, but I know I can't hold you. So I'm going to make it quick. One of the biggest questions that people are asking me to ask you is the things that we're hearing on social media about the heat and heating and steaming and lemons and drinking hot tea and all of those things that they're giving us. How true is it to the virus as a nurse, from a nurse's standpoint, as far as heat and 80 degrees plus killing viruses? How true is that? Because we need some closest possible home remedies if you're locked in the house and this and that. So I'm trying to give people a simple solution to kind of try to get ahead of the game.
Good question.
So there's nothing better, Stan, than simple soap and water. There's nothing better than putting a little Clorox or some Lysol and wiping all of your high-touch areas down in your home. As it relates to some of those home remedies, what I will say to you, there is no current medical cure for COVID-19. And people need to understand that. Using the steam, drinking hot tea, those are all things that will alleviate symptoms. It's not going to cure you of anything. We've all had a cold at some point, and you drink the hot tea because it relieves the symptoms. It doesn't cure the cold. Right. So there's a difference of managing symptoms and actually alleviating the bacteria and or the virus. So people need to understand that. Secondly, there's also such a thing called as viral load. As you've heard multiple people talking about, touching food or touching a packaging and different things like that. There has to be a specific viral load that is on that package in order for you to contract it. That is why they're telling people to often, if you want to wipe it down or spray it down, that's fine. But the best thing to do is really use warm soap and water and wash your hands, for the 20 seconds. So hopefully I answered that question. There is no straightforward scientific, I'm sure if that was scientific, Dr. Fauci and those individuals from CDC would have shared that. But I do believe that some of those home remedies, if you will, are simply allowing us to alleviate those symptoms. But if you need to get tested, you need to check with your healthcare professional. You need to make sure that you don't have any a consistent or persistent cough, chest tightness, difficulty breathing, and or if you're febrile, meaning that you have a temperature. So please make sure that you don't just do those home remedies without ensuring that you're consulting with the healthcare provider to help give you some appropriate guidance.
So what if you have all of those symptoms absent a fever? Then is a person pretty safe to say, you know what, I have all these other symptoms, but I don't have a fever or a temperature, so I don't have COVID?
Terry, you asked one of the most important questions that even I myself currently have. As a nurse, as a healthcare provider, I have personally touched and cared for and taken care of individuals who have been diagnosed with COVID-19. What I will say to you, by God's grace, I have not exhibited any symptoms, but what we are now finding is that you may have some asymptomatic, meaning not having any symptom carriers. And so we don't know. And so that's why it's important for you to stay in the house with your husband, love on your family, and hopefully as this time period goes by and we figure out exactly how to cure this, if you will, or have a vaccine that's developed for it, if you will, and or to determine when more testing can become available, then that's the only way we can really know. But right now we don't know. And that's exactly what I think some of myself and others and any leader of any worth his or her salt should say. You can't say what you don't know. And so right now we are in the realm of unknowns, and I think that is why even the first question that was posed about, remember a few weeks ago, we weren't told to wear face coverings in public. We were just told 6 feet distancing. Now the recommendation has changed because the key word in this virus is novel, meaning it's a new human strain that has not yet been tested. And so until we get that those studies have been done, we won't have an answer for that. So right now, for all we know, you could be an asymptomatic carrier of the disease, come in contact with someone who has a weakened immune system, and then you could unknowingly pass it on to that individual.
Yeah, wow.
Good information.
Yeah, one last question for me. I don't know if Stan has any more, but one last question for me is, as a nurse, and you're on the front lines, what are you doing? What are you people like you doing to keep yourselves healthy? Is there some sort of way that you all are keeping your immune systems boosted high? What tips can you provide to those of us who are healthy right now to stay healthy?
So again, this is just me making recommendations or sharing what I do, not making a recommendation rather, but sharing what it is that I personally do. I still exercise as much as I can. I'm actually actively training for the Chicago Marathon in October, so I hope it still goes on. So I still make sure I still get my longer runs in on the weekend. I do literally will move across the street if somebody is on the street where I am. I absolutely keep a mask with me, and if I'm running by anyone, I put the mask on, but I will intentionally literally cross the street from that particular individual. Secondly, just try my best to get rest, and to be very honest, it has been difficult because it is, anxieties are high, fears are high, and I would not be a truthful individual to say that I don't have them, because I do. When you're leading a team of individuals who, as you indicated early on in the show, that's walking into this every single day, you can't have but some type of trepidation yourself. You don't want to carry this home to your family. You know, I have a husband and a child. I don't want to bring this home. What I also do is ensure that I'm taking, my multivitamins, I'm taking my B12, and I'm just making sure that I'm eating healthy as much as I possibly can. And quite frankly, as your husband shared, I'm just a person of faith. I have to ensure I have, faith over fear and peace over pandemic and Christ over the COVID virus, and just really resolve that I'm doing my absolute best and that I will be covered. And that's kind of how I'm managing throughout this pandemic, like all of us are.
Thank you
I love
so
all
much.
of those things that you just said.
Yeah.
Peace over pandemic. All of those things are wonderful.
Christ over COVID.
Christ over COVID more
Yes.
than anything. That was most important. Those are the things that you choose to fight and win.
Yes.
You have to know and line up. And I appreciate you lining up and saying those things, because those are some of the bigger things as a defensive mechanism, in my opinion, that we need to have.
Well, Meedie,
And,
I cannot thank.
Oh, I'm sorry.
Oh, no, I'm sorry. You go ahead. I'm sorry.
Oh, I was going to say, to add on to what you were saying, Stan, I think that the challenge right now is that we are fighting the unknown. There's so many unknowns, and we as Americans, I believe, we need answers. Not just Americans, but just people. That is our innate thing. Is we need answers for what's happening and why. And is there a pill for this? Is there a cure for this? Is there a test I can take? That's how we have continued to operate. And I think now, because this is the first pandemic that any of us have ever lived through.
Yep.
The last major pandemic was the flu back in 1918, and and that killed, so many people. And
Yeah,
so
like
we
50
have
million.
not had that right now. And so this is an unknown and uncharted territories for us. But what we do know is that it is real, and that we must do the things that are necessary to protect ourselves and our family and our loved ones. And now my call to action would be to be a little more communal and less individualistic, to reach out and, the old song says, reach out and touch someone's hand. Well, we can't do that right now, but go ahead and, do this, Skype, FaceTime someone, Zoom someone, send a text message, let them know that you're thinking of them. Because another concern that I have is just our mental space.
Yes.
And how are we all handling this when we're all being so secluded? And it's almost as if our very freedom has been taken away, where you're just kind of, reduced to staying in your home. So for me, you have to find some way, even for those of you who are not in the healthcare field at the moment or considered essential, we have to absolutely do our best to still do our best and take care of ourselves.
Absolutely.
Well
I cannot
said.
thank you enough, Meedie, for being a part of our Spotlight family. If you ever need us for anything, please, if you need to come back on here at any time to get a word out, please let us know. We appreciate you and for being a hero and being brave out there. Thank you so very much.
Definitely.
Thank
Definitely.
you.
Thank you. And you'll be able to watch this on our website later.